Perfect. Okay, so this week we're hosting sessions from organisations who took part in the Catalyst Sector Challenge programme, which was funded by the National Lottery Community Fund. And these projects were a collaborative effort from organisations working in the mental health and the sexual abuse and domestic violence sectors to solve some of the challenges that emerged from COVID-19. And today we'll be hearing from some incredible speakers about their project on improving social prescribing. So I'd like to introduce Susie Perks, Kate Gibson and Vikram Singh from Lightful, a B Corp certified digital company, about how they've approached the challenge, what they've discovered and the tool that they produced. And with that in mind, I'd love to hand it over to the team now to take you through that.
Lovely. Thanks very much, Helen. Welcome all. It's an absolute pleasure, I'd say, to speak with you all today and to showcase what for us has been an incredibly highly impactful project around social prescribing. We ourselves have learned a lot about the challenges and opportunities in social prescribing through this project. And I've also learned that there are many opportunities for this tool outside of social prescribing as well. So we are very excited to take you through this today. And would also love to hear from you as well, whether at the end or throughout this, on what your thoughts are about how you can imagine taking this forward for its own purposes as well. So without further ado, I'll take you through our agenda. So we'll explain a little bit about Lightful and who we are to begin with, and then move on to the meat of the project around what the challenge was with our initial project and how we described the challenge, how we went through the human-centered design process, how we applied it to social prescribing, and then we'll give you a detailed demonstration of where that was applied at each phase of the tool. So first I wanted to introduce ourselves and our speakers today. We're the team who worked on this project and ran the human-centered design process, but we also had a big team behind us as well, helping us deliver the technical project. So I myself am in charge of our product and solution business areas at Lightful, which I'll talk a little bit more of in shortly. Vikram is our wonderful lead UX designer. User research and design is something that we put front and center of every project at Lightful, and believe it's what makes our projects unique and stand out, and more importantly, fit for purpose for all of our users. Vikram led on the design workshops of this project and has been responsible for the phenomenal outputs and speed prototyping that we're about to showcase. And Kate, who leads our business development team, but also likes to get stuck into some of our interesting projects and was at the heart of this work, leading on our approach, organisation and setup, and ensuring that we met the needs and goals of all the charities that we worked with. And we're all very proud to work for a company called Lightful, a technology company powering social and environmental change. We started out Lightful as a technology company to serve those working in the sector that needs it the most. We've brought through a fantastic team of experts from non-profit, educational sectors, and combined with private sector experience to support our cause of strengthening relationships between good people and great causes through technology. We're also a certified B Corporation, ensuring that community, the environment and our staff are central to all of our decision making. Our people and products support non-profits in 58 different countries around the world, and some organisations that are solving some of our planet's greatest challenges. And here's some of our team as well. So how we're set up to deliver this impact, we split our services into 3 closely interconnected but discrete flagship services: products, solutions, and learning. Lightful Products helps drive organizations forward with beautiful ready-made software solving the sector's most common challenges. So as a couple of examples of our products, we have our social media platform, which helps charities schedule social media content, increase engagement and save time. And also we've built our own what we call Lightful components, which is a toolkit of adaptable components designed to build engaging and online communities. Lightful Solutions provides bespoke technology and digital strategy solutions such as online communities, CRM support, digital fundraising and scoping. And finally, Lightful Learning, which helps our partners master real-world skills through a combination of tools and support. So we aim to build confidence and resilience and grow those through digital skills to increase the effectiveness of the nonprofit sector. And all of these services work together to meet the various unique needs of our nonprofit clients globally, of which here are a small number of our clients on this slide as well. So as you can see here, there are very big clients from Citizens Advice to newer, more startup style charities like Frontline and Help Refugees, but all with a common purpose to use digital to their beneficiaries, staff, and all their users alike. So enough about us at Lightful. I will pass on to my colleague Kate now to take you through our social prescribing challenge.
Thank you very much, Susie. So first of all, wanted to start by, I suppose, kind of talking about what do we mean by social prescribing. So really, this is kind of any local non-clinical support services provided by the community in order to improve patients' health and well-being. All are about taking a holistic approach to people's health. We'll talk about link workers and social prescribers throughout the process when we run through this presentation. And those are the individuals who work across the health sector and connect people to community groups and statutory services for practical and emotional support. The services that they can refer people to could be run by organisations across the nonprofit sector, including local, national charities, community groups, or council-run activities. And our challenge was to look at how we could innovate and strengthen data sharing between services in order to promote better social prescribing across organisations in the mental health and wellbeing sector. And our presentation today will talk about how we went from this, which was a small snippet of what a social prescribing process looks like, to this. Importantly as well, we did this all in 11 weeks. So here's just a quick high-level run through, and Vikram will kind of pick up in a lot more detail about what we did at each of these stages, but wanted to give an overview of what the process looks like. So first of all, we started with our discovery process, and within that we had 7 workshops, 12 one-to-one sessions, and several at-home tasks, really kind of looking to unlock and pinpoint the key challenges in the social prescribing sector. We then moved on to ideation of prototypes, and within that we created 4 different prototype versions, and across those there were 35 potential pages that we looked at. Then we moved on to user testing, and we spoke with over 20 social prescribers and link workers, really to kind of understand and gain insight and feedback on the prototypes that we developed. Our 4th stage was the tool design and development. So taking that insight from the user testing and the prototype ideation to take forward the most valuable prototype and create a usable tool from that. Finally, we ran through our testing and data collection. And within that, we collected over 300 data points, and we'll run into exactly what we use those for shortly. So, as Susie mentioned, there was a very large team involved in the project, as well as from organisations outside of Lightful. We worked with the Chatty Cafe, and pleased that Abby is able to join us on the call today. So the Chatty Cafe is a charity offering chatter and natter tables, virtual chatty cafes and weekly calls, all aiming to kickstart conversations and get people chatting and reduce loneliness along the way. We also worked with Middlesbrough and Stockton Mind, who are a leading local mental health charity in Teesside, with a mission to ensure that everyone in their local area has good mental health. They work with every community and individual across Middlesbrough and Stockton to ensure that they can access the support required to improve emotional well-being. We also worked with BVSC, who are the Bexley Council for Voluntary Services, set up to support organisations and residents in the London Borough of Bexley. BVSC is the go-to place for all things community and voluntary related, whether people want to volunteer their time, are looking for volunteers, or want to find out about local organisations. Finally, we partnered with the Bromley by Bow Centre on the project. Bromley by Bow Centre are a pioneering charity that combines an extensive neighbourhood hub with a medical practice and a community research project. They're a leading expert in social prescribing with over 20 years experience in developing their model, and are currently working to support NHS England with the scale up of social prescribing across London. Last year, the Bromley by Bow Centre supported over 300 organisations and 1,300 individuals to learn about the centre and social prescribing. During the project as well, we were also supported by Helen from DOT Project, as well as Catalyst, which was what this project was part of the wider programme, with funding by the National Lottery Community Fund. And now I will hand over to Vikram to run through exactly how we kind of used human-centered design in this process.
Thank you, Kate. Yeah, so the approach we used for this project was human-centered design, which really was important to do because we wanted to make it participatory, and we only had 11 weeks, a very short amount of time to do this project. So what is human-centered design? Well, really it's designing by addressing the reality of how people think and behave, and how they work, what they do. It involves human perspectives at each step of the research and design process. And maybe you're thinking, well, I thought this webinar was about design thinking. In a lot of ways, human-centered design is another term for that, or user-centered design. We call it human-centered design. Promise we won't throw too much jargon at you, but there will be a little bit, but it will be clearly explained, I promise. So yeah, do you want to go to the next slide? Why human-centered design? Well, human-centered design is different from traditional design approaches, which tend to start from really specific requirements or technical possibilities, or ideas from people who have a lot of power. And this means that people have to adjust their behaviors to suit these products or services. Whereas HCD, or design thinking, really aims to align products and services with existing behaviors, needs and goals. This in turn ensures that products are suitable to the kinds of people who actually need them. So some key principles of what HCD is. Really, it's about, as I said, starting with underlying problems or needs of users, not the technology. It's being solution agnostic, so not having a solution up front. So traditional approaches often have solutions up front and then try to figure out how to make them work. This is saying, starting with an open field, saying, where can we possibly go? Doesn't rely on people telling you what they want, which might sound counterintuitive, but if you think about it, it's really about digging into what the needs below some of the sort of superficial needs are. So really, what are the fundamental kind of core needs? And sometimes people might think, oh, I need VR or something, when really what they need is something much simpler than that. As I said, it involves users through all stages, so incorporating how they think and what their feelings about things are. As we included the charities that Kate mentioned, we included them through all the stages, but also testing these ideas with users. So we wanted to bring in external users and actually test them, which I'll go into in a second. Exploring multiple ideas. This is similar to being solution agnostic. You don't want to just put all your eggs in one basket. You want to have multiple ideas and kind of remove the ones that aren't working and maybe iterate on the ones that are working. And don't design for averages. You know, if you think of a door designed for the sort of average height of a person, that doesn't make a lot of sense. You want to design for the tallest person. Designing for averages doesn't really work. You want to design for specific types of people. and think about the entire journey, right? So not just individual parts of a journey, not the interface, but really the entire flow or journey of the sort of user experience. Go to the next slide, please. There's a bunch of these. If you Google design thinking, you'll see lots of different graphs and charts about how this works. I won't go into all of these. I'll go into one that's maybe a bit simpler, which is on the next slide that we use. So this is how we conduct human-centered design, or human-computer interaction, which I have up there. So essentially, to start out, what you do is we start with a discovery stage, which really is about learning about the users in the wider context. And that really is observing users, speaking to users, understand the entire journey. And that's about diverging, where you're understanding the wider range of all of these activities, right? Not just narrow, but a wide range of the users and their activities. And then you want to converge by saying, okay, what is the highest priority problem? What are the key challenges? So you, out of everything you learned, you want to define and re-narrow again, so you converge. And then once you have that defined problem, what you want to do is you want to diverge again and try to think about ideas that solve that specific problem or problems. And then you want to evaluate, which again is converging by narrowing down on that one idea that really addresses that identified problem as effectively as possible. And that involves prototyping and what you call user testing. That's the theoretical bit. But how does that work in principle? Well, that's what I'll chat a bit about next. So let's go to the next slide. So we started out with a discovery, and we really needed to answer these questions. What is social prescribing? We came in with not a lot of knowledge, right? The charities where we work with obviously did have that knowledge. What kinds of tools and activities are involved, right? We don't know. Different charities use different tools, different processes. What are the key challenges? Obviously very important to think about identifying what those challenges are, so we can work on addressing them. So to start out, what we did is really think about, we used a technique called user journey mapping, which really was because Kate and I really didn't have a lot of ideas about what everybody's different journeys were, who we were working with. And in addition, each of the charities we were working with didn't know each other's journeys. We asked them to simply map them out. So you can, and this is really simple. We use a tool called Miro. It's just like little Post-its, but digitally. So you can see a couple of examples of the journey. So, in the top when the patient visits the GP sends a referral to the social prescribing inbox. Then there's triage, and then there's a referral. So really just getting those out of our charities' heads and onto, quote, paper. That's what we did for each one. And the next step, what we did is really trying to map out the entire service. So we have all the individual journeys. What does the service look like from a helicopter point of view, right? So what are all the steps that you would need to, that are involved in creating and conducting social prescribing? And in addition to that, what are the key activities, actors, and information involved? And what that looked like for us, if you go to the next page, it's a bit hard to read. So, but what this is this is the service blueprint for social prescribing that we created. So you can see that there's different steps. So the first sort of major step is setting up a service provider for social prescription. So you need the first step within that is identifying gaps in services and then determining if the area is suitable for particular services. And then we thought about activities and actors involved. And that area is just the top left corner of a much larger blueprint. So why do we do this? This is part of the discovery process. So really what we want to do is get everything out of people's heads and on paper to interrogate it. It forces you to articulate things that are otherwise implicit. It helps us understand each other better and gets consensus on what the key challenges, actors, and goals are. So if we go to the next page. So we had that helicopter view. We understood, it had a communal understanding of what social prescribing was and the broad challenges, but now we needed to narrow in and define what those key challenges that we wanted to address were. So what are the highest priority problems to be addressed, and what are the kind of feasibility and constraints around them? So what we did is, if you go to the next slide, if you'll remember, again, and I appreciate this is not easy to understand, but one of the points I should have mentioned too is we really want to make it messy. When we're thinking, we don't make it neat, we make it very messy, as Abby will mention. We got everything on the page. And as part of the service blueprint, what we did is we talked about the challenges. And you can see these big red blocks are challenges. And we grouped these challenges. So obtaining and showing qualitative feedback was one that we all agreed was a key type of category. And you see those stars there, those are how we voted on them as well. So we had a bunch of challenges, we grouped them, and we voted on them, all based on that sort of service blueprint. So if you go to the next one, and we ended up with sort of a few of these key challenges that we decided that were the most important, highest priority, and feasible really to address within the time that we have, as well as other issues around GDPR and ethics and obviously things like that. So those were really about gathering starting from the top left, gathering relevant and descriptive qualitative case studies for positive outcomes, helping beneficiaries, volunteers, and link workers, which is another word for social prescribers, feel supported so that they can make a meaningful difference, and also give social prescribers better referral options. And options is a key word there that we'll go to in a bit more. So if we go to the next page, now we were into the fun stage, which was ideating. So we had a helicopter view. We prioritized the key challenges. Now, what can we do to address the identified priority challenges? How can we turn those ideas, so the ideas for addressing those challenges, into designs? There's a bit of a jump there, isn't there? So if we go to the next slide, so if you'll remember, one of the ones I talked about was suitable and robust onward referral options, which is again, who can we refer to in the community? What kind of service providers can we socially prescribe people to with various issues or challenges? And we just brainstormed ideas. We brainstormed ideas together. We thought about constraints in a really unstructured way, but given the challenges we have. So one of the ideas we came up with was, if we create a journeys triage and prompt system that provides what areas a person may need help in, we can provide confidence for link workers and help beneficiaries, which is one of the challenges, if you remember. And the second one is, if we create personas of beneficiaries, then we can better understand and tailor services to demographic needs and understand personas' related needs. What are the challenges and problems do they have? And if you're not aware, personas are sort of profiles of different types of people who may have particular challenges. So we voted on it, and we felt that these were two of the most feasible, effective, and useful ways to address this and a couple other challenges. So we started a step which some people found outside of what they normally do, which is sketching. And so, I'm sure many people haven't kind of quote unquote sketched, which is really about kind of creating designs, right? And why is that really important to do? Because it allows you to get things outside of your head that you have a vague idea about, and once you put it in a digital format, you start to understand the constraints and what works and what doesn't. And I really want to emphasize that anybody can do this, right? So what we did here is we have, if you look on the left side of the page, it's just a bunch of components. It's like Lego. You have little drop downs, you have little toggles, search boxes, text links, and you could just drag those and put those on a page. Again, we use a tool called Miro, which we could do together and watch each other do. So we were all able to do that. We all created our designs. People who hadn't used this tool before were really able, again, to have ownership and participate in this kind of solutionizing. And again, it allowed us to really interrogate these ideas and challenge them, as well as vote on them. So if we go to the next page. And we voted on them and came up with a particular structure, which I won't go into too much detail because it'll sort of reveal itself, of how we felt these ideas would be best manifested. From there, we sort of iterated on them. So we took them away and we said, okay, here's 3 different ways we could, if you remember, the idea was a sort of a triage system that was followed by personas. So if you think about a triage system, what's the best way to do that? Is that the top left where you select from big boxes, or the one below where that's separated into support area, demographic information, challenges, or maybe the top right that's a little simpler. So how do we decide between different versions? What do we do? Well, that's the next step. And that is evaluate. Right? So again, we're converging once we've diverged. And that really to help us understand which of our designs or ideas work best. Does it actually solve the problem it's intended to? How can we further improve our designs? So how do we do that? Well, what we do is we turn these into we turn them into prototypes, which is a way of saying that what's the simplest way that we can confirm or deny the kind of essential truths about these different ideas, right? Because each one sort of embodies a slightly different way of thinking about these solutions. So these are essentially screenshots. They're just interactive screenshots that we created. And what we did is we got real people, real users, real social prescribers and service workers in to test them. And I want to emphasize here that it's not just about asking what they like. Right? So we didn't ask, which do you like? We watched how they interacted with them. We watched what kind of questions they have. We observed what they didn't do in addition to what they did do, right? All of this is really important because that's how people would naturally use them, and what people say they might do isn't necessarily indicative of what they would do. So prototypes are very important. And if you go to the next slide, so we had these two different versions here, which I'm sorry, I apologize, it's so blurry, but the top version, it's hard to see, but there's different steps. So there's issues, demographics, and results. So you go through different steps. And the bottom one is really all it is just selecting a challenge area. So emotional trauma, legal issues, and then you get support based on that. So these is an example of two versions we tested. Go to the next slide. The top one was preferred quite a bit more, which was surprising. We thought something simpler would be liked more, right? That you just select one box and you get results. Whereas the top one, you had to select issues, demographics, in addition to going through more steps. But the reason why that is because we found that people needed something more useful than just Google. The one at the bottom really isn't that much more useful than Google, and they like feeling that they get something that is curated rather than just you click once and you get a result, right? And it also generates more useful results as well. So what did we end up with at the end of the process? After we did the evaluation, we ended up with a prototype that was really validated through user testing. We ended up with a social prescribing support tool, it's always a mouthful to say, which addressed the established prioritized pain point opportunity areas. So those, which is what we call the challenges, essentially. And the tool helps users to explore what the needs, goals, and service suggestion of and services of someone who may need help. And it's important to say that this one thing that we learned was you can't say definitively what someone needs. So we were at pains to really say that it's a suggestion, which is slightly counterintuitive because it's prescribing. But that's really what the goal was. And it also provided examples of case studies. It gave confidence to social prescribers, especially for people who they were less sure about helping or how to help them. So sort of people who maybe had characteristics that they weren't accustomed to. And we had emergent findings, and that's one thing that that's really important about HCD too, is keeping an open mind and finding new things as you go along. So this really helped social prescribers think outside the box. One thing we found as we did this is they said social prescribers really rely on one or two, or sometimes rely on one or two service providers to prescribe to. And this gave social prescribers new ways of thinking and less sort of transactionally, if you will. So now, well, after that, we actually built it, which we will show now.
Sorry, I'm just adjusting my screen sharing just to.
And I just do also want to emphasize while Kate's doing that, is that we really involved our charities at each step of the way. So as much as nice as Susie was to say that, you know, Vic did this and that, really I felt like I facilitated it more. In each step that I was talking about, this was all of us doing it, not just me. Anyway, sorry, go ahead, Kate.
Thanks, Vikram. So here we have the final end result of the tool that we've developed. So hopefully you'll kind of be able to see elements or components of it that kind of came through on Vikram's designs that he'd kind of shared within his slides. So when people initially kind of land on the page, they're provided with some information just around really what this tool does and what this tool doesn't do.
Yeah, and we as sort of I mentioned before, we really wanted to emphasize that these are suggestions, and we wanted to emphasize that as we learned, we don't want to put people in a box. You know, we learned as a social prescriber, you don't want to treat someone as a box, as a specific person. So really what we're intending to do with this is stimulate new thoughts and new ideas, and not say, here's what you need, but consider this, think about that, ask these types of questions.
So once you've kind of gone through the landing page, you can click begin. And here you have all of these different category areas. So there's a total of 15 different category areas. So everything from computer skills to legal issues, money issues, general mental health. And when you go through, you can select up to 3 of these.
One of the biggest challenges was really understanding what issues to have here. You go too broad, then the results that you show at the end aren't very helpful because they're not specific enough. Too specific, there's too much to select from. So a lot of the testing and iterating was understanding what's relevant and what's not. We certainly didn't capture everything, but we captured as much as we could to have use as part of this experience.
So once you've decided on which of the issue areas to select, you can then click next. And within here, again, you can add in some gender, age range characteristics, as well as some broader demographics. So where something kind of might impact every kind of facet of someone's life, there's an ability to kind of select here so you can paint that picture of the person.
Mm-hmm. And it's again, playing with these kinds of challenges was again, a lot of iterating on what's useful to show and what's not useful to show. But really, this is about personalizing the results so that they are more impactful and making it a bit more human.
So for this example, we'll select a woman who's between the ages of 18 to 25, and we won't add in any of these other demographic characteristics. So clicking next brings you to the final results page. So here you'll see all of the issues, gender, age range, as well as kind of the other characteristics that have been brought up. When you update any of these items, then the images that are displayed here will update accordingly. So we could change to male and it would bring up. So it's not meant to be prescriptive, but kind of really building that picture of what the person could be that you're looking at. But within this page, we then run through 4 sections. So we've got potential challenges and considerations. So each of these are kind of areas that might be relevant to the person who you're looking to support. So things that might be affecting them and ways that you could consider addressing them. So women with emotional trauma related to historic abuse may find it difficult to interact with men. So should you use a female interpreter? Should you signpost to women-only groups? So they may not always be relevant to the person, but the important thing is that they could be. It's prompting you to kind of think outside the box, whether there's other factors at play. And it will show 3 to start with, and then you can click to view more. Vikram, is there anything on this section?
No, yeah, I think you covered that again. Yeah, to really provoke thought rather than to be prescriptive, as it were.
We then move on to service recommendations, and within here, we have service activities, service search tips, as well as self-help tips, which hopefully, well, it might be further down. Anyway, but again, these service recommendations are meant to be at a higher level than there is a local group that kind of operates in a small part of London. It's more principles-based recommendations that means that you've got that kind of like broad applicability to be able to kind of help and support. And these are all tailored and targeted to the specific issues, areas, and demographic characteristics that you've kind of selected earlier on.
One thing here you might ask, well, why aren't there specific services? And this is something that we quickly realized actually by doing this process wasn't something we could do, because there's so many directories. There's so many directories of services, and they're so quickly out of date that we realized that we couldn't, it'd be fruitless to recreate yet another directory. That potentially is something we could add on in the future, but really these are how to find services and the types of services rather than specific services.
We then move on to some suggested online resources. So here's information areas where, again, kind of accessible across the UK and open to everyone. So it might be where you kind of want to find out some more information about what that person is kind of struggling with, or areas that you could kind of signpost and provide some more support. Again, you can click view more to see any of the other options that are brought up. The final section on the results page is the case study. So here there's 4 information areas. So the beneficiary profile, as well as kind of what the agreed action plan was to support that person. So painting a picture of what their challenges were and what was kind of suggested to be able to support them. Then we've included the insight on what helped them, but also what didn't help them, to make sure that you're painting a picture of actually where something's been successful or where something has maybe not been successful. So to really share those learnings around what worked, what didn't work, and whether there's kind of an opportunity to try something new, try something different, that may not have been at your immediate forefront, but really kind of seeing the practical applications of it.
And yeah, we don't have the actual Airtable up, but what we did is how we collected all this information was really talking to social prescribers and getting to input all this information into a tool called Airtable, which we sort of use as the back end, which then forms all of these results when you search something. So these are actually really from social prescribers and service workers. They're from their actual experiences. It's not things that we're making up. It's actual things that these people have found helpful.
And so we have also made it so that it is fully responsive across mobile and other devices, so that people can access it wherever they are kind of looking for support and wherever they are. We've only got 4 minutes left, so really kind of, I guess, wanted to open up to everyone just to see whether there were any questions, whether it's on the tool that we've developed or whether questions for Vikram on the approach that we followed through it. Please do either unmute or you can send us a message in the chat box if there's anything that we've not covered that you would like us to run through at all.
Hey, I'm Kat. I love that presentation. I think that you're right, that it's so difficult to kind of try and maintain, or there's no point in kind of replicating these local maps, because there's maybe 5 or 6 that a link worker will traditionally kind of look and browse through, and they all kind of quickly get out of date. I found that when I was creating the website mypickle.org. So what we do is we signpost national services, not local services. Mm-hmm. So we actually, that enables us to kind of cover a massive broad brush of topics and really crowdsource and find out what are the helplines, the apps, the support groups, no matter what problem anyone's facing and where they are in the UK, because there actually is always sometimes support there for someone. It's just about finding it. The question is more about the kind of curation of the resources, because I can understand in some circumstances, for example, if you're looking for domestic abuse support, then there's very much, you know, targeted charities and services for older people, younger people, LGBT community, and so on. But where there's not targeted services, what's the purpose of that curation? Because in essence, it wouldn't necessarily change the results. Like, did you find that? And how did that impact the user expectations?
Sorry, were you saying that there isn't always specific results for different types of inputs, or?
Yeah, so for example, if you're looking for debt advice,
Yeah.
probably not a great example because there is actually, I think, some like kind of debt advice for females versus males. But
Yeah.
if there was no differentiation between the services available, then there are kind of putting in or trying to select an item that's not ultimately going to affect the results.
Yeah.
Did users realize that, or how did you manage the expectations around that, or how would you?
So what we did is we made the second step quite optional. So you don't actually have to, you can just select an issue if you want. And if you select, you're right, for debt advice, you know, that's not specific to any one type of person. There might be some things though that are specific, especially case studies. So if you're narrowing it down to a particular type of person, might have a different challenge because of their age or because of perhaps another challenge, an impairment or something. Maybe they can't go somewhere, and then those become a bit more relevant. So we try to show the most relevant ones first in the results, and then the less relevant ones. So things will always show up, but you're right. For some, it's less relevant than others.
All right. Okay. Cool. Thanks.
Thanks very much. There's been a couple of questions come through in the chat, so I will try and speed through those quite quickly. So what's been the feedback and impact so far? So we really kind of only finished off the project in the past couple of weeks. So this is a very initial kind of prototype, looking to kind of develop and get feedback on. So we're going through that process. But the initial feedback has been really positive in terms of offering something in terms of that persona-led advice that hasn't been available so far. Main customers primarily was designed for social prescribers, but certainly kind of had feedback on additional use cases, whether it's kind of understanding and helping train volunteers if they're kind of working with specific types of people to understand what other issues may be kind of feeding in. And data running reports, not currently, but that's definitely something that we're kind of aware of. As it is past, I really don't want to keep people any longer, and appreciate all of your time in joining.
Brilliant. Thanks so much, Kate, Susie and Vikram. That was a really, really brilliant presentation of the fantastic work that you've done. So thank you so much. What we will be doing after this is sending a follow-up to everybody that has attended today. That will have the slides, the recording, and then a bit more information about how you can get in touch with the team at Lightful if you want to take these conversations further. And for the rest of this week, we also have a number of other webinars that you might be interested in. Tomorrow, we're going to be hearing from a team that has designed a digital tool that's intended to support remote support workers. So those working in the mental health space that have found remote working and supporting beneficiaries hugely challenging during this period. And then on Thursday, we have another webinar, which is looking at providing effective online counselling to survivors of domestic abuse. So we'd love if you could also attend those, but we will also be recording and making those available as well. But yeah, just a huge thank you from me for attending today, and hopefully see some of you later on this week. Thank you.
Thank you.
Thank you.
Thanks.
Bye.